Prior to administering sedative or analgesic injections for the oral examination and dental procedures, we think it's best for veterinarians to attempt to determine the horse's overall health status through obtaining a proper medical history and performing an examination of the horse prior to giving the medications. Those medications are generally administered by intravenous injection in the jugular vein. There is risk associated with that injection if it's performed improperly. There's an artery that lies in very close proximity to the vein, and if the medication is accidentally injected into the artery, the horse will immediately seizure and collapse, and the horse could be severely injured or suffer permanent damage from that event. Once the physical examination is completed, the next step is to obtain a preliminary look into the mouth. The way that's done when the unsedated horse is to just gently grab the lip and retract the cheek with a small light source. Horses have a threshold of fear, anxiety, or discomfort that will be tolerated, and once that threshold is exceeded, you may initiate a flight response from the horse, which can be a very sudden, violent attempt for the horse to leave the situation. When that occurs, the horse could be seriously injured or could injure bystanders that are near the procedure. In order to administer the intravenous injection properly, the veterinarian should first wipe the skin with alcohol. Aggie weighs about 1,350 pounds, so we've calculated the proper dose of xylazine to administer. So we'll occlude the vein and visualize where it's located, just under the skin, and then we'll give the injection. Once the needle's into the vein, we can verify that because there'll be blood that's going to come back into the syringe. So we know we're in the proper location. We're using proper technique, so we know we're not in the artery. And we'll pause for just a few minutes, and in about 2 or 3 minutes, Aggie will be very sedate and tranquil. It's been about 5 minutes since we administered the intravenous injection of xylazine to Aggie. She's very sedate, very tranquil, very relaxed. We've applied a dental halter to help support her head at an appropriate height. We've gone ahead and placed the dental speculum and secured the strap, and we've placed the light source that we're going to use for the oral examination. First step is to open the speculum slightly and make sure that the horse is going to be tolerant of having the mouth opened. Check and make sure the tongue's not trapped, make sure the lips, everything looks okay. Everything's fine. So we're going to open up the speculum just wide enough where we can get a good look inside the mouth and pass a hand into the mouth to palpate the teeth. Okay, all that looks pretty good. So we get the cheeks retracted, and we'll take a look in here. It's pretty evident right off the bat that Aggie is missing an upper right first molar, and as a result, as we talked about earlier, there's continual eruption of the cheek teeth. So the opposing tooth, the lower right first molar, has become overgrown, and that can impair chewing function, impair mobility of the mandible. There's a number of sharp points that are present within the mouth. And so she's a good candidate to be here in the hospital today to have some dental work performed. In order to help remove and smooth some of the sharp points in Aggie's mouth, there's a couple of options we have. One option is to use some type of hand file to help smooth these points. So there's different lengths and different types of configurations of hand files depending on what portion of the mouth is being worked on. What we're going to do first here with this file is we're just going to demonstrate this on one side of the lower cheek teeth. We're going to take the file and place it in the mouth and get this in the appropriate position. Just make some nice little short pull strokes with the file. And then reach in with the hand just to verify that the floating procedure has been successful, and everything feels pretty good on that side. Another option when filing over long teeth or sharp points in horses includes motorized instruments. This is an example of a power instrument that has a rotary disc, a carbide chip blade. It's a variable speed. This blade is guarded, and so it causes very little trauma to the oral soft tissues when used properly. We'll place this in the mouth, and we'll just turn the motor on and see how she tolerates that. She seems okay with it. Now we'll place it on near the overlong tooth. Now a little bit more length needs to come off. You don't want to stay on the tooth too long with a motorized instrument because it could heat the tooth improperly and cause damage So we'll work in a different area of the mouth for a few minutes. For the purposes of the presentation, we did not film the entire dental procedure for Aggie, but we've taken care of all of her dental arcades and everything looks good. We've taken great care to minimize trauma to the oral soft tissues and to the teeth. And with any dental case, we want to avoid unnecessary complications such as excessive bleeding, infection, facial swelling, or pain.